let's talk a little bit about 2016 outlook. I'd say outlook, but it's not really the outlook anymore. We're almost here in March, and so we are rolling. We're looking at a lot of increase in supply. So the biggest increase in supply that we're talking about would be the sow inventory. With PED, we're now still coming up from the uprising of all those sows that are coming on board, all these different new farms that have added to our inventory within the United States, as well as improvements within the genetics that's increasing the number of pigs and the number of pounds that we're actually getting to these markets. Our decreased feed costs also help encourage our producers to keep those pigs on feed, as well as increasing, like I said, that number of pounds of pork that we're sending to that market. Our plants are not coming back on board until at least 2017, and that's only 2 of them. There's a couple more that are actually coming on as well. So, given all those facts, what do we do today to advise our clients how to be successful in a low margin market? We're not in a negative market by any means, but how do you be as efficient as possible in these low markets? Nothing's new. Efficiency is king. So, biggest things, maximize the potential of your resources. Resources are not just drugs, bugs, vaccines, people. Nell's talked a lot about utilizing your best asset, your biggest resources, your people. And that does not escape any part of the protein industry. And I want to push everybody to evaluate your existing protocols. You don't know how many times you walk into a farm, you're like, why are we still doing this? We haven't had PED for 2 years at XYZ farm. Which, don't get me wrong, we don't want to get that, but we still have all these different intensive protocols in place that might not be pertinent today, that are taking up time and effort, and are we even actually doing the proper job of the proper protocol that we actually initially put this in place for? As Jim always likes to push out, at least push down my throat half the time, everything up until that pig is hanging upside down is a cost center. Cost center, cost center, cost center. I'm a cost center. Proud of it. So now is a more important time than ever to make sure we look at every single one of those cost centers. If we don't need it, why are we still using it? And so along all those different areas, we want to make sure that we're managing our risk effectively as possible. So whenever we talk about approaching any sort of problem, whether it's at home, whether it's at school, whether it's at work, blah, 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 you always want to strategize. Don't go into the game, don't go into the football game having no idea what the heck different plays you're going to run, etc. Step 1, gather your facts. Figure out what is happening today and what your numbers are, what the actual numbers are. Plan ahead, because this always happens to me. No matter what can and will go wrong, will. Same thing, another thing that Nels talked about earlier today was you cannot use any information of things that you do not measure. So making sure that you've got accurate measurements, making sure we're recording all the actual deaths and that we're not just hiding them. And always be ready to adjust. Be flexible. So within that, I just put up a quick little intervention strategy that we talked about that we've talked about. A client and I that I have talked about in wanting to use a different antibiotic at 3 different points within the production phase. And on average, this is going to cost us about 20 cents a pig. And that's big. So taking a look at some of your current facts and figures and saying, okay, I agree to jump on board with this. As long as you're on board with this, let's go ahead and reevaluate what our return on investment is, not just 6 weeks out, but then, when you start a new process, you got to get the wheels cranking, you got to get people involved, you got to make sure that we're following the actual protocol, like he said. So let's make sure we go ahead and find any intervention strategies that are going wrong at 6 weeks and then come back again at 12 weeks. So at that point, we went ahead and our biggest return on investment would have been our pre-wean mortality reduction. So within the first 6 weeks, we went ahead and reduced that by 0.8%, giving us an estimated 52 cent return on investment, which is really great. 12 weeks out, once we started getting the wheels going and we turned into a routine a little bit, that turned in an 89 cent return on investment just by dropping that pre-wean mortality 0.2% more. However, all of a sudden, an accountant comes in and makes sure, holy crap, we've got everybody that is out there working, and we're putting 3 extra hours per person that's on the farm. Now, my clients obviously will have the type of farms that are overstaffed rather understaffed. So this is a huge detriment when it comes to the end of the pay period, bringing our true return on investment a lot less than what we originally thought. We were making nearly $1 every single time that we put one in. So make sure that when you're coming through and measuring, that you're measuring all different aspects that are going to come through the pipeline and affect your strategy. So when I first got into vet school, I'm like, these are all the 3 tools that I'm ever going to need to do. I'm just going to diagnose, I'm going to treat, and I'm going to prevent all day long. All day long, I'm going to bust these 3 things out. Well, you know, that doesn't always necessarily. You're also turned into HR, which I'm not good at. I need my own department some days. You also turn into a therapist, and I don't like listening to whiny people all day long. But you end up doing all these different strategies that you had no training for, and you hear things that you never wanted to hear in your entire life. However, amongst all that, so we talk about quickly just about diagnostics. So what is the goal? Are we looking for disease outbreak? Are we looking to do some surveillance on some disease monitoring, whether that's flu, influenza, mycoplasma, pick your disease of the week? Are we talking about an individual pig, whether we're talking about show pig here? Are we talking about a lot of group, a cohort group that we're going, flow, or even some of the things that we've been able to have some tools come to our hands recently with the regional model when we're able to utilize facts and figures that are coming from around that actually have an impact, not necessarily just in our practice or just within our clientele's portfolio itself, but also what happens with Bob down the street, what bugs he's got that's all of a sudden going to turn into a risk for myself. All these advances in the time turnaround of all of our diagnostics, whether or not that's on reporting and the quality of our assays, a lot of that has a big impact on how we're able to do our jobs better. And same thing with able to be prepared in case we get a foreign animal disease, like we talked about recently with Seneca Valley virus. Being able to utilize that model to be able to plan and prepare for the future. Just our other little bit of toolbox things. I love the KISS principle. Keep it simple, stupid. I'm in the same boat, just keep it simple, and that'll be the best thing for myself and as well for the producer. So we come up with treatment protocols around seeing XYZ disease, and not necessarily disease, but clinical signs. And this is going to be the drug that you're going to use for this type of pig at this stage and at this body weight. Or we can at least use our diagnostic space where hopefully they're not medicating them for 10, 12 days and then calling you saying, hey, I've been using this and it's not working. So we're actually using evidence-based medicine to make the best decision on what antibiotic to use and duration. Same thing when we can use disease surveillance to be able to see what pulses of medication might be worthwhile if we've got a continuous flow group. Prevention strategies. So we talk about biosecurity. We talk about a lot of things on here with flow. All in, all out, herd closures, single source. We all know that these things work. It's been proven time and time again. So utilizing these things to these assets that we have to be able to utilize them in their full potential. Just quickly here, gilt exposure. We talk about acclimating gilts. And the goal of acclimation is to be able to expose every single one of our gilts that are going to be our replacement breeding animals to whatever bugs that are already on our farm. And it's a carefully timed program that we want to make sure that they get sick before we ever put a rot in them, right? So there can also be some complications with that. So just threw some example of the feedback on there, some complications that can happen with that. Are we actually exposing them to the desired bugs that we want to? Is that bug viable so that we're actually going to get the response we think we're supposed to be getting? Are we having a consistent dose from this group to this group and even within the same group itself? Complications from there can actually create variation in immune status, and all of a sudden you've created pockets of animals that don't have the same immune status that you thought that was in that same group. That can affect also the duration of their immunity. First things first, do no harm. So make sure we're always utilizing diagnostics to our advantage here. Don't just assume. You know what happens when you assume. You make out of you and me. So step 1, determine what your current endemic pathogens are. Get a sense of what is actually happening within your herd. Evaluate your existing protocols. What are we doing and why? Making sure that we're being as efficient as possible. Just because we've always done it doesn't mean we always need to do it necessarily. What is our goal that we're doing with these protocols? Are we just trying to prime the immune system? Are we trying to booster? Are we always coming back and priming when we think we were boostering and all of a sudden we don't have the same level of immunity as we thought we were going to? And how easy are we making it for everybody in the barn who might not have the same advantages that you and I with education? So one, is it getting done? Is it getting, my favorite thing that I learned, IP, you would think the intraperitoneal. No, is it getting in the pig? Is it actually happening, or am I getting it into the pit? IP, another IP. Or is it the other thing that you can sit there and walk into a barn and see somebody squirting something out the curtain. You're like, just to prove that they thought they did something for you. You know, you come in and you check your bottles, and all of a sudden they realize, okay, well, she's coming in and checking bottles. Better make sure that bottle starts disappearing a little bit. And is it timely? So, best method of trying to figure out what is going on in the barn. Utilize a student, right? There's plenty of them, and they're very eager most of the time. Step one, make sure that they come up with their list of potential pathogens so that they are actually developing a certain sense of education here. You're not just spoon-feeding them what you think is supposed to be happening. Do not provide them a current vaccination or acclimation program. Have them spend time in with the people that are in the barns actually doing it to see if they can learn from even the people that are out there actually doing the acclimation stages. And set them loose. They're allowed to ask any question they want. They're allowed to take notes. They go and actually vaccinate with the groups, and then come back and report and be able to work on a project together. You find so many things out. There were so many times that when I was a student, Jim would send me out in the barn. He'd be like, okay, go ahead and stay busy for an hour. All right. Now he was off, I'm assuming, doing more important things, and I was actually getting an education, but I might have just been entertaining myself. Who knows? Always making sure we remember, just because you can measure it doesn't mean it gives you an immune status, or serum is not equal to everything. So we might be able to get better results by taking a different sample, utilizing your diagnosticians and to their effective level to be able to see what am I supposed to measure if you don't know. So we've all seen this before, the cost of multiple agent infections, and they still hold true today. These facts and figures might actually be worse in a certain degree. However, the biggest take-home effects of this is that if you have a multiple infection going on, it's not just the additive effect of those. It's nearly 1.5 times or greater impact on cost to your client. And in a low margin economy, this is huge. So one of our, things that we see all the time, mycoplasma, except if you're in a mycoplasma-free herd, lucky you. I never get to see that. But we know that seroconversion usually comes later in the nursery stage and in the finishing stage. And so if we delay the transmission, we're going to delay the onset. Now in a finishing group, that's great. If we can delay it until the point that they're going to get their heads cut off, that's great. However, if you're working in a gilt developer and you're delaying that onset, well, you're just delaying it closer to the point where they're going to get bred for that first time when it's the most important breed for them. Same thing, vaccinations. I tell my producers all the time, just because you're buying an insurance policy doesn't mean that it means you're never going to get infected. It's going to reduce your clinical signs, but not reduce your transmission. So it's not to say that you're not going to get infected. So as a result, is vaccine going to always just be my answer necessarily? We need to utilize a lot of the things that we know are tried and true, like all in, all out, and being able to be flexible with our flows and to be able to change things, to be able to make an impact on being able to actually create cohorts of groups here. And if not, maybe elimination strategy is the way to go. But in some cases, when you're going to eliminate a bug from a system that's going to go back and throw a naive animal back into a positive farm, that might not be the answer for your system. Once again here, I just want to impact the fact that if you've got more than one bug that you're working with, it's going to be more than just the additive effects of that single infection. So what's the biggest thing on not only our reluctance to change to be able to put some of these things in place, but even to be able to create that for our producers? We're all creatures of habit. Just because this is the way that I've always done it, this is the way I'm going to do it. Worked for my dad, it's going to work for me. And we talk about, with PED, when we saw a lot of the commonalities and the risk that was associated with PED, some of the barns, or the majority of the barns that didn't get infected, they had minimal probability of contacting the virus, aka they wean once a week, or maybe once a month. the less amount of times that something shows up to the barn to be able to be a probability that you're going to get infected, the better. How many of us have actually changed flow from the insight that we gained with all the PED that we dealt with a couple years ago? I know I did. We went from twice-a-week weanings to at least once a week. And I love it. But the biggest thing is some of that sticker shock. You've got to use all this matrix to be able to get these animals lined up into a group, and all of a sudden, okay, if I miss breed target, I'm not just going to make it up next week. I'm done for a month, or I'm done for a week or 2 weeks, whatever your batch setup is. And so a lot of that initial gut reaction phase is something that really puts everybody off, and you can't conceptualize what the change on your farms are going to be. Habits that we do on an everyday basis are processed in our brains 1,000 times faster than anything else. So I'm a right-handed person. I would say that majority of you are probably right-handed people. Imagine for a full week, you're going to get paid $1 million as long as you never used your right hand. What things would you put in place to make sure that you could make that $1 million? I would put stickers every single place so that I made sure that use your left hand, use your left hand. You'd tie your right hand behind your back. You would shock yourself. You would come up with all these different things to mentally prepare yourself and create a plan to say, this is how I'm going to follow this and this is how I'm going to ensure it. That's what we should do when we're coming up with different protocols for our clients. We should come up with paths of least resistance to be able to make sure that this is the way that you're going to go. And as we repeat that focus, we create a conditioned response. We create a sense of normalcy in an abnormal manner. So same thing. Make sure we're planning ahead for it. Have a clear vision of the plan. Make sure we create a timeline of when events are supposed to happen. And it's clearly understood, not by myself, but for also the people that are going to be executing it. Don't just involve the higher up management. Bring everybody to the table so that they understand and they're a part of the conversation. Identify any barriers that are going to help you, actually be disadvantaged. Not let you get to the point that you want to. Like I said, always make sure you measure your success along the way. And that's not just at the end of the project we see how well we did. No, at several different points along the way, make sure that we're measuring and we're staying on track to our initial plan. And provide support. The best thing that we can do as veterinarians is to show up and be there for not just the clients, but for also every single person that is working on the farm. You would not believe how much respect you gain, and then you're able to actually learn exactly what they're doing, the things that they might internalize as something that they can't get done with their job, and you can help them with that. So an example of planning ahead for success, I have a client in Southern Illinois that's a 2,800 head sow farm. It was a closed herd with internal multiplication for nearly 10 years. Well, you, like everybody else, got exposed to our 174 virus in May. So it didn't matter if it was cold outside or warm. We got it anyways. So initial plan, curse loudly, kick something, punch something, regroup. We stopped internal multiplication immediately and came up with the idea to eventually, with everybody, all the stakeholders involved, to do a delayed herd closure with a rollover plan with an offsite breeding project. We were going to bring in some genetics that were of a little bit higher value from another farm located in South Carolina. So initial plan on all offsite breeding projects, which is usually an old crappy finisher that nobody else wants to use. That's why it's available, right? So our last group on the sow farm was bred week 38. Breeding project initiated 7 weeks later. So doing some quick math, that means our last group was due to wean on week 3. Our bred animals were due week 7, so we were going to bring them in 2 weeks early. And that gives us about 2 weeks downtime to be able to clean up the barn, do all the repairs we want, and put all these different biosecurity things in place. Super plan. Christmas was super this year. I got lots of presents that I didn't necessarily want. One of them being that a sow farm nearly not quite a mile away broke with PRRS from our offsite breeding project. Like I said, that is a bundled up mess that we walk in between barns with boots that you might change boots when you get to the door. You might not. You might wear your street clothes, whatever. So just to give you an outline of the farm layout of the sow farm itself, one big breeding barn with gestation, one big lactation barn, and then a gilt development barn. So at this point, week 52, gilt developer's been empty for a long time. At that point, when we initially broke, we went ahead and got rid of all the youngest animals because we knew we weren't going to utilize them towards the end. And then once our sows were done lactating, they just never got bred again. We let them dry off. We pulled them into breeding and gestation, and then we trickled them once we found availability in a cull market to be able to get them off-site. So once again, we come up with a new plan. We'd be flexible. You kick, scream, all that stuff. Then you regroup. Now at this point, we hadn't been testing pigs because if you're not going to use any of the information, why are you going to spend your client's money? So we weren't testing the animals. We knew we were getting rid of them anyways at the sow farm. We did initiate all McRebel so that you would improve the status of them downstream so that you could actually raise the pigs. So we needed to go through and test some wean pigs to see what our site status was at the sow farm, as well as we wanted to see what the initial state was at our breeding project. So at this point, I'll get there. Then we were going to empty the remaining inventory that we had in gestation, load our last groups into farrowing, and then ship everything out of gestation so that we had an empty breeding barn there. So like I said, I showed you the layout there. We'd be able to create 2 separate populations with a clean, dirty line that at least I think I can manage better versus walking between barns that's less than a mile away from our positive sow farm. So we create our on-farm clean, dirty line, and we continue to monitor every week for any change in health status that would foil our plans completely. So results, week 53, we tested all the wean pigs, not all of them, but a subset of them. And we tested every single barn that had bred, gilts, and sows inventory within our breeding project. They came back negative. Everybody holds their breath. The next 2 weeks, we rushed like heck to transfer everything off of that site onto our site. And week 3, everything else had already farrowed out, and we weaned everything and cleaned out the rest of farrowing and began cleaning that. Went ahead and tested our sows. They've stayed PRRS negative so far. Thank you, Dr. Harker, for working with me on that as well. So some plans don't go as planned, and then you're flexible a little bit. You have to come up with, plan B, C, D, and so far it's worked. So with that, I talked about an on-farm clean, dirty line, and with that, I'm talking about biosecurity or bioexclusion, however you want to utilize it, which is a system of measures that we put in place to be able to minimize risk of bringing in an infectious disease into our herds. Infectious disease, we all know this, any sort of abnormal state of the pig that's going to be detrimental to them. It's either going to reduce feed intake, cause death, or maximize their amount of time that we're actually going to get them into market. Just because they get infected with bug X does not mean that they show and display that disease. It's all dependent on the agent itself, the virulence of the virus itself, the host status, as well as environment. And like I said, there's a lot more healthy bugs than there are harmful bugs out there. So when we think about disease transmission, we think about 3 primary things. So we've got our microbe, and Brian really wanted me to be a little bit more visual with this, so there's our microbe. And we've got our pig. And so we might have a pig-to-pig transfer. We might have a fomite, which here, this would be a truck hauling donkeys or hauling donkeys. Or we might utilize something like a vector, which might represent you or I that's going to go ahead and infect our pig. It's a sad little cartoon. We've all likely been exposed to the epidemiological model involving susceptible, infected, and resistant. 3 different states of an animal or a group of animals in a population, and ways that we might intervene within those 3 different areas to try and reduce the amount of animals that become within that infected and therefore lead to death. Here we're still talking a little bit about biosecurity. So stopping transmission. I've learned at least one thing in EVP, and it's to always make sure you make charts about everything. So when you're trying to make a decision about what different advances in biosecurity you're going to do on a farm, because they obviously want to do something that's cheap and nobody's going to cheap, free would be even best, but then I'm not going to have to do a lot of work to create. So that puts us in the high impact, low effort bucket. Bucket, another word that you're always going to use. Things that are going to cost you a lot or be really hard to implement would go in your red square. So being able to work with your producers and determine what things they're willing to do, and areas in orange would be something that we might table or go ahead and do a financial model to see whether or not we want to make that decision on our farm. But to be able to prioritize what differences that you want to make on your farms. So along those same things, consider what we're already doing today. How often do we actually evaluate the biosecurity protocols that we've put in place? How easy have we made them to fail at executing? So, booties. How many times do we see people put on booties? You're still sitting in the car, put the booty on, then step outside. Then we go on the farm, come back in, step in your car, put your feet down, then take the booty off. We just completely missed the mark on why we actually put those in place. That wasn't to keep your shoes clean. Same thing, showers. How many of us have taken a shower where it's literally a hose sticking out of a wall and you're just like losing your entire religion, just getting, oh, I do that, it's fun. But you still have to do it. But how many times do you think that Bob or Joe, he's just like, I'm not going to do that. I'm not going to take a shower out of a garden hose. So really evaluating what we have in place and how easy and how welcoming we've made that for you to be able to execute. No one asks for help. So popular phrase that I utilize a lot would be that you can do all things through Christ who strengthens you, right? So a nice little story about this man walking through the desert. This guy walking through the desert, he's got very minimal clothing on, and he's got no food or water. He's been out there hours, and it's 110 degrees, and it's humid. Well, he comes upon, and he's got a lot of faith in God, so he completely realizes that, you know what, I can do anything through God because he's going to save me. Well, he comes upon a woman who's carrying wool with her camel that she's walking through the desert with. And she says, here, let me help you. Please take one of these and utilize it. It's going to get cold tonight. No, ma'am. I believe in God. I have faith in Jesus, and he's going to save me. I don't need you to save me. And she implores, no, please take this. You don't realize how cold it gets at night. No, I've got this. So reluctantly, she moves on. The man keeps trudging through the desert. He comes upon another woman that she wants to show him how to forage and be able to find things to eat and hunt with scorpions and other gross stuff that's in the desert. I don't know. And once again, he says, no, God's going to provide for me. I don't need your help. She insists again, and he backs her down, so she reluctantly leaves him. He comes upon a third woman who's going to show him where to get water, because at this point, he's completely quenched for thirst. And once again, of course, he says the same thing and pushes her away. Well, homeboy dies, because that's what you do when you don't have any shelter in the elements. And he's up, and he's meeting his maker, and he's like, why didn't you save me? I believed in you. I turned away help. I believe in you. Well, you're an idiot. I sent you all this help, and you turned it all away. What more did you want me to do? It's a sad fact. But many men this year will die simply from stubbornness. Moral of the story, no one asked for help. Last piece of puzzle that we have that's a really, really big resource to utilize. I've had the pleasure of being able to be involved in an area regional control project that started, about October, November of 2014. When we first started seeing some of the virus pop up within Jasper County. I'd like to say that we stomped it out within those first 3 sites, but nope. Still haven't figured that bad boy out. However, there's a lot of resources at our fingertips to be able to use, not just through BI, but a lot of support, not just through utilizing things such as Basecamp as well as BioPortal, but funding as well for some of the diagnostics that we've been able to do with the project. And it's really trying to shift a lot of the emphasis from being veterinarian driven. We feel like we program our people all the time and we shove things down their throat. Well, look at this, what I got from a drug company. Look at this that I got from a drug company, you know. This is an asset that we can utilize that's a lot of driven by producers, or in hopes it's driven by producers, to be able to keep them motivated and to be able to keep them talking about what the different risks are out there and to be able to report when they've seen clinical signs so that they can share that with all their neighbors and other people that might be affected. Being able to utilize such an advanced database to be able to coordinate your disease monitoring and providing information on a quarterly basis, a monthly basis, however you set it up, it's a very flexible program. And being able to set goals as a group. So this is just a quick screenshot of my dashboard. Shows a couple of the different tools on there. And I know a lot of you have already seen some of this before. But shows mapping data as well as the classifications of some of the sites that are out there, whether or not they're actively shedding, whether they're negative, and being able to take your existing farm and be able to determine how close you are to Bob who's got this disease. And then when you realize you and Bob share the same disease, how closely related those different viruses are. And we can utilize this not for just PRRS, but applications for influenza, for PED. So there's a lot of good things coming forward with it. This is just a blown up picture of that map, and another blown up picture of the heterology here. In conclusion, there's a lot of different things that we have at our fingertips to be able to coordinate as a group and to be able to utilize for our clients, to be able to look towards the future and plan ahead, to be able to maximize that margin, however little it is.